Hey everyone, welcome back to our channel Canadian Nurse Expert. Studying for a competitive exam can be tough, like trying to learn a new language, but we'll get through it together. Today, we're tackling mental health nursing with some tricky NCLEX-style questions. These questions will make you think hard, because the NCLEX isn't easy. Grab your snacks, get ready, and let's get started. It's time to boost your NCLEX skills. Okay, Nursing Star's first question. Today, we're diving into the world of obsessive-compulsive disorder, or OCD. It's a condition that can be incredibly challenging for both patients and healthcare providers. So, let's get started. Imagine you're on the mental health floor, and a patient keeps checking the door locks many times an hour. This behavior is not just a quirk, it's a manifestation of their anxiety and obsessive thoughts. It's making them very upset. What should you do first? Your initial reaction might be to stop them immediately, but let's explore the options. Your options are: allow the client to continue the behavior to reduce anxiety. Set strict time limits on the compulsive behavior. Explore the feelings underlying the compulsive behavior. Redirect the client to a more productive activity immediately. Let's look at the first option. Let them keep checking to feel less anxious. This might seem like a compassionate approach, but it only provides temporary relief. This seems easy, but it doesn't help long term. The anxiety will return, often stronger than before. Option B. Set times for checking. This structured approach can help manage the behavior, but it doesn't address the root cause. This is better. Setting limits is good, but is it most important right now? We need to dig deeper. Option C. Figure out why they're checking. Understanding the underlying anxiety or fear is crucial. We have a winner. Understanding the reason is key. This insight allows us to address the root of the problem. Option D. Give them something else to do. Distraction can be helpful, but it's not a long-term solution. This helps, but it doesn't fix the problem. The compulsions will likely return once the distraction is gone. So the answer is: explore the feelings underlying the compulsive behavior. We need to understand the underlying cause of their behavior. This involves having a compassionate and open conversation with the patient. Are they scared? Do they need to feel in control? These questions can help us uncover the root of their anxiety. Once we know, we can help. By understanding their fears and anxieties, we can develop a more effective treatment plan that addresses the core issues, providing long-term relief and support. Moving on, question 2. Today, we're diving into a critical aspect of mental health care. Imagine a patient with depression who has just started taking an SSRI, a common type of antidepressant. These medications are often prescribed to help manage symptoms of depression. As a nurse, you need to watch them closely, especially during the initial stages of treatment. This period is crucial for monitoring any changes in their condition. So what's the most important thing to look for during this time? Your options are: increased sedation and drowsiness, symptoms of serotonin syndrome, worsening of suicidal thoughts, onset of withdrawal symptoms. It's essential to be vigilant and aware of any potential side effects or changes in behavior. While SSRIs are generally safe and effective, they can have side effects. Some of these side effects might be mild, but others can be more severe and require immediate attention. Let's look at the options. Option A. Increased sedation and drowsiness. This can happen, but it's not the biggest worry. Sleepiness is a common side effect, but it usually isn't dangerous. Option B. Serotonin syndrome. This is serious, but it's rare. It occurs when there's too much serotonin in the brain, leading to symptoms like agitation, confusion, and rapid heart rate. Option C. Worsening of suicidal thoughts. This is scary, but it's the right answer. Unfortunately, some patients may experience an increase in suicidal thoughts when they first start taking antidepressants. Option D. Onset of withdrawal symptoms. These happen when you stop a medication, not when you start. It's important to differentiate between starting and stopping medication. So, the answer is: worsening of suicidal thoughts. Increased suicidal thoughts are the most critical risk to monitor when a patient begins an SSRI. Sometimes when people start antidepressants, they get more energy before feeling better. This can be a dangerous time if they have suicidal thoughts. This newfound energy can make them more likely to act on those thoughts, which is why close monitoring is essential. That's why watching them closely is so important. Your vigilance can make a significant difference in their safety and recovery. Question number 3. Let's dive into a critical scenario that you might face in your career. A patient with schizophrenia is taking haloperidol, an antipsychotic. This medication is commonly used to manage symptoms of schizophrenia. 2 days later, they're stiff, have a high fever, and are confused. These symptoms are alarming and indicate a potential medical emergency. What do you do first? Your options are: administer prescribed benztropine, notify the healthcare provider immediately, monitor vital signs and continue observation, discontinue the haloperidol immediately. Let's have a look at our options closely. Option A. Administer prescribed benztropine. Benztropine can help with certain side effects of antipsychotic medications. This can help with side effects, but is it the priority now? In this situation, we need to think about the most immediate threat to the patient's health. Option B. Notify the healthcare provider immediately. This is crucial because the doctor needs to assess the situation and decide on the next steps. We have a winner. This is an emergency. Immediate medical intervention is necessary to prevent further complications. Option C. Monitor vital signs and continue observation. Monitoring the patient is important, but it's not enough on its own. Watching is important, but we need to do more. Option D. Discontinue the haloperidol immediately. Stopping the medication might be necessary, but this decision should be made by a doctor. This might be needed, but only a doctor can decide. The doctor will evaluate the risks and benefits before making any changes to the medication. So, the answer is B. Notify the healthcare provider immediately is the best course of action. These symptoms could be neuroleptic malignant syndrome, NMS, a serious reaction. NMS is a life-threatening condition that requires prompt medical attention. We need the doctor now. Quick and decisive action can make all the difference in ensuring the patient's safety and recovery. Question 4. We are talking bipolar disorder. A patient starts taking lithium, a mood stabilizer. Which lab value is most important to check regularly? Your options are: liver function tests, thyroid hormone levels, serum lithium levels, blood glucose levels. Lithium can be very helpful, but it needs to be at a safe level. Looking at our options, option A. Liver function tests. Important, but not the top priority for lithium. Option B. Thyroid hormone levels. Lithium can affect the thyroid, but is it the most critical? Option C. Serum lithium levels. Bingo! This is the one. Lithium needs to be within a safe range. Option D. Blood glucose levels. Important for health, but not the main concern with lithium. The answer is option C. Serum lithium levels. Regular blood tests are key to avoid problems. Okay, NCLEX Rockstars, last question. A patient with GAD has tense muscles and can't sleep. What should you do first? Let's see the options. Teach the client progressive muscle relaxation techniques. Discuss the importance of a consistent sleep schedule. Recommend avoiding caffeine and other stimulants. Suggest engaging in light physical activity during the day. We need to get a closer look at our options here. Option A. Teach them muscle relaxation techniques. Sounds good. Option B. Talk about a regular sleep schedule. Good sleep is important, but will it fix the muscle tension directly? Option C. Recommend avoiding caffeine and other stimulants. This helps with anxiety, but will it help the muscles right now? Option D. Suggest engaging in light physical activity during the day. Exercise is great for anxiety, but is it the best for immediate muscle relief? The best option here is Teach the client progressive muscle relaxation techniques. It helps relax the body, which can calm the mind and improve sleep. That's it, future nurses. We covered 5 medium difficulty NCLEX-style mental health questions. The NCLEX is about using your knowledge in real situations. Practice thinking critically, and you'll feel confident on exam day. If you liked this video, give a thumbs up, subscribe for more NCLEX help, and leave comments about what you want to learn next. Keep studying, believe in yourselves, and I'll see you in the next video.